Hello, ladies and gentlemen, greetings. I am Dr. C. N. Srinivas, Director of the Laboratory Medicine, Miyad Hospitals, Chennai, India. So the next case number 8 and 9 are interesting for us because how urine analysis machine can give a pathway or lead a pathway to prevent the dreadful damage of the kidney because of the bugs, that is the urinary tract infection itself. So case number 8 is a simple case, but it gives a lot of information to us. She is a 51-year-old female. She was proposed to be a donor for a solid organ transplant. The routine urine analysis was performed on her. So the urine analysis shows hematuria. She has got nitrite positive, has got leukocytes. Now, when we come to the microscopy here, you have got WBCs to be positive, most of them to be neutrophils. You have got bacteria of more than 500 per microliter. It's around 20,000 per microliter. So keeping in view the presence of the leukocyte estrase, then you have got hematuria, mild amount of glycosuria in this patient, mild amount of proteinuria you have got in this patient, one can think that she is having a urinary tract infection. Now, imagine if you have an analysis machine which will be able to flag off whether this is a gram-negative or a gram-positive bacteria for our clinicians. It is wonderful. Let's see how this analyzers do this. Now, when we come to the flow cytometric analysis of the urine, the scatter plot here, what you are seeing classically has been flagged off for a gram-negative bacteria. So the gram-negative bacteria has been flagged off by the urine analysis machine, which is one of the interesting facts for us to trickle down to that of the clinician to say that, look here, we have a urine analysis, has a urinary tract infection caused by that of the gram-negative bacteria itself. The urine was sent to that of the microbiology. You can see the leukocytes on the UD machines, and you have a petri dish having E. coli grown, which is a burgundy purple or a pink color colonies in this case. So this is a case which illustrates very clearly that the urine analysis machine can give an information about what type of organism this people might probably anchor in the urogenital system. Let's take up one more case of urinary tract infection. Here we have got 62-year-old female. She is a known case of nephrotic syndrome on treatment. That means she is immunocompromised. She was admitted for a day care for a minor surgery. She got discharged, and after 3 days she presented with fever. Now, simple urine analysis was mind-boggling to us, where we had got leukocytes to be present. Proteinuria is also present in this case. Mind you, there is no nitrite. So that means this is something to do with out of probably some infection. So let's see the flow. So when you see the flow, you have bacteria here. So presence of a bacteria here, where you have got leukocyte estrase positive, you have got proteinuria, nitrite being absent, probably something to do with that of gram-positive organism. And let's see the scatter plot whether it gives any clue. Yeah, it gives a clue because the magenta color distribution of the scatter plot is away from the x-axis, and it says that probably it is a gram-positive bacteria itself. See, one of the uniqueness about the Sysmax urine analysis machine is that it is able to give us an information about whether it is a gram-positive or a gram-negative microorganism in the given urinary tract infection, which helps us to make sure that which urines can go in for that of the cultures, so that we will be having a good harvest of information. So let's see the urine culture for this case. Here UD imager shows a lot of WBCs, and if you see the class 1 there, you see small rod-shaped bacteria over there. The culture of this grew enterococcus, which are tiny bluish green colonies on this petri dish. So a beautiful illustration of a case where we are able to pick up urinary tract infections based upon the urine analysis machines itself.